So I'm Niall Winters. I'm an associate professor at the Department of Education at the University of Oxford, and the project is mCHW, is about investigating the use of mobile technologies to support the training and supervision of community health workers in Kenya. So what we're hoping to achieve in this project is an upskilling of community health workers. So areas that they themselves have identified as gaps in their knowledge, developing mobile tools that address those gaps and therefore build capacity locally in developing better training opportunities for the community health workers and hopefully leading to better care for people in their communities as a result of that improved training.
We worked with 2 communities on the ground in Kenya and trained community health workers there. We trained around 100 community health workers in the assessment of developmental milestones of children under 5. We're talking here about very, very low resource communities, so they often can't afford the bus fare to go to the nearest hospital because it's too expensive for them. They can't afford medication for their child who has epilepsy. So for them to be able to get the support they need to really improve their situation, I think that's what we are hoping to achieve. So the mobile learning intervention did not start out as a disability project per se. It's really an outcome of the project that we came to find this sizable number of disabled children. And having been here at the workshop today, I think we can continue to build the collaboration with other people who are specializing in the field of disability to really help these communities, help the health workers to achieve the best outcome. One mother told us that for her, she's not even allowed to put up the laundry on the communal washing line because other neighbors had told her they are afraid that they might their children might catch the same disability as her child. So we're really talking about huge challenges here.
So the main partner was AMREF Health Africa. It's one of the biggest African NGOs headquartered in Nairobi. And then with the health workers that they had previously trained, we worked with them to design the intervention or the tool that then the community health workers would then use in their day-to-day work.
We decided to design a smartphone app that they could use to assess the development of children under 5 using the Malawi Development Assessment Tool, which was developed by Melissa Gladstone and her team. So that was the basis for the smartphone app that they used. And we co-designed the app together with them. So we had a number of workshops where we went with them through the layout of the design and everything. So they were really involved from the beginning. We also had exchange visits between the communities, which they liked very much because they felt it gave them a flavor of what the other communities were doing, the one in the rural area and the one in the urban area, to see the differences between the practices. And we had exchange visits between our collaborators in Kenya and us. So our collaborators came and visited us in the UK, and we had an evaluation workshop together with them to capacity build with our collaborators. So we've trained, had workshops with policy makers, with people from the Ministry of Health in Kenya, together with AMREF. But I think what we need to achieve, and that's our next step, is to raise awareness on these levels of the issues surrounding disability and surrounding capacity building on these higher levels of the health system with regard to catering to children with special needs, with regard to education for children with special needs, so as to really achieve a wider impact, particularly in our case in the field of the health system, so to get better care for these families, for these caregivers and their children, to make sure that they really get the care and the support that they need.
And the other audience are the health workers themselves, so raising awareness among them of issues to do with disability and how these young women and the children can be better supported.
We have our health workers already in place, so everything is in place. We can really rely on the infrastructure that we built up in the mCHW project. So we have a very small pump priming fund from the University of Oxford that will keep us going for the moment, but hopefully with additional funding in place, if we can get the funding, we hope to be able to really get to train the community health workers properly, that they then can go out and explain to other people how disabilities come about.
And so working with AMREF and the local health workers, we developed support groups in 2 areas in Kenya, and continue to work with these young women and to understand their experiences as mothers of children with disabilities of the healthcare system, the challenges they face, for example, and how those can be overcome. At the moment, we're running workshops with the community health workers and their supervisors around this issue of raising awareness. We're extending the use of the application that we've already developed, and we're engaging with some policymakers who have an interest in disability to think through the ways in which those issues can be better addressed within the community health worker curriculum. So I think the Impact Initiative will be really helpful in linking us up with other researchers doing similar work, perhaps in other areas of the globe. So we work primarily in East Africa, but I know they have projects in other areas of Sub-Saharan Africa and also in India. So bringing us together to help share our experiences, not only from a research point of view, but also in terms of what that means for linking more broadly, for example, with policy or policy development within countries. So I think looking across projects to see what collaborative outputs will be useful as an outcome of the projects themselves, rather than outcomes of each individual project.